You don't have to ask me twice. We'll make something.
Stephen Miles, Deputy Premier. Everyone's got good audio? Excellent. Set? Yeah.
Thank you.
Okay. Well, this is a really very exciting announcement. These patches are the future of medicine. They will allow us to monitor just about anything that you can test with a blood test, either in real time or as required. We can put them on patients in hospitals, relieving our nurses, giving them more time to take care of patients, but people can also be wearing them at home and in their workplace, and they can monitor things like their hydration levels, predict whether they might be about to experience a heart attack, so that we can administer treatment faster, ultimately save lives. This is technology created here in the backstreets of Brisbane, and together Wear Optimo and the Queensland Government and their partners intend to take this to the next level, commercialise manufacturing, manufacture 26 million of them every year in a new facility here in Brisbane. In the process, we'll create something like 90 jobs. So this has come from small beginnings right here, Mark, and I can see how proud you are, to something that will be in the market, saving lives at first here in Australia and the United States, but after that the world. Did you want to say something about it?
Sure. Well, thank you. And you did such a great job explaining what our project's about. So I'm delighted to be here today. Really the key word that comes to mind for me is time. Our micro wearables, they're all about buying time for people. When a situation comes up where you need a rapid readout that can make a difference, that's what the micro wearable is for. So in some ways, it's important to reflect on this point in time that we're at as well. So it's a journey here that Wear Optimo has been taking, where we've started from humble beginnings, as you rightly said, Minister, and but we're excited to be here today because this is an important next step on our journey. This is a project that's of the scale of the order of about $30 million, and it's here in Brisbane, and it's to make end-to-end production of micro-wearables, up to 26 million micro-wearables per year within the next couple of years. With our partners, and our partners, I'll introduce you to them just now. Our partners are, of course, the Queensland Government. But in addition to that, we have, I guess the banners probably illustrate it quite nicely, but the people behind it are important to point out as well. So the Australian National University, so I'm delighted to say Keith Nugent is here today, our Deputy Vice-Chancellor for Research and Innovation. But also the Australian National Fabrication Facility, and the CEO, Ian Griffiths, is over here as well, and you'll hear from both of them in a moment. Yeah, I can't overstate how excited we are. It's an interesting era that we've moved into, where it's manufacturing. We're doing it here now. We're not doing it offshore. We're doing it here, and that's as a result of all manner of events that have taken place within the last 12 months, and I'm excited about that as an engineer. It's also time to acknowledge, and I'll do it very, very briefly, but it's important to acknowledge the supporters that have helped us on the way, and of course our partners going forward. And first and foremost, I'll acknowledge my wife Faith. So she's been with me through all of the rides, 20-something years in the making. I won't give away anything about our ages, but yeah, I'd like to acknowledge Faith in everything she's done in living and putting up with an entrepreneur like me. So in addition to that, of course, the backing from the Australian National University, they've come on board and done something really different. They're here in Australia, of course, but they're here in Queensland as well. And Keith will talk about that in a moment. I'll acknowledge the team of Wearable, fantastic team, high-performing team right here in Brisbane. We're not in Silicon Valley, we're here in Brisbane, but we've got the calibre to compete with anyone. So I'm excited about that as well. And I'm sure I've forgotten someone, and it's not on purpose, but partners, including, of course, Aspen Medical and Glenn Keys. I'm delighted to say Glenn's flown up from Canberra to be here with us today, the chairman of Aspen, and we have a fantastic partnership with them. So I won't say too much more, other than just to show you what it's all about. So first I need to remember how to do this, but okay, so what we have here is an example of the kind of product that we're talking about. So this is a micro-wearable. I'll just move my shirt a little bit to get that out of the way. And the idea is to actually have a real-time readout. So we do a scan, you have a readout, and in spite of the fact that I'm sweating, yes, I am still hydrated. So that's just an example of the tech that we have. That's what the micro-wearable sensor is for. I could take forever to talk about it, but I shouldn't, because time is valuable. But I will say we're up for the challenge in front of us. We're delighted by the support we have. We acknowledge the responsibility that comes with that, but we're up for it. And I should say from here on, it's time. Okay, thank you.
What was your reading?
Surprisingly, it found I was well hydrated too. So the 4 coffees this morning mustn't have affected it.
But it can be expanded to other things, can it? Does it still sound like you're going to do blood testing for various diseases and that sort of thing?
Yeah, that's right. The technology allows the technology allows for monitoring and testing of just about anything you can test with a blood test, including the precursors to things like a heart attack. So it can monitor people who might be at risk. One of the early applications of the hydration testing is in the workplace, in mines and construction sites, where monitoring that kind of thing really can be very important.
Good job.
Okay.
How much is the Queensland government chipping in as part of this deal, and where's that full funding coming from?
So this is funded through our Essential Goods and Supply Chain Fund. That was the fund that we created last year when it became clear that to be able to deliver continuous healthcare to Queenslanders, we needed secure supply chains. We couldn't continue to rely on manufacturers overseas, and we've seen why that's so crucial, not just during the initial COVID phase where those supply chains were disrupted, but also since then when you've had situations like countries blocking the export of vaccines that were required for their local population. So this is all part of our strategy to secure our supply chains, to do more manufacturing here and also diversify our sources of manufacturing.
And so how much money is the government putting in?
As is the case with these kinds of arrangements, the contribution is commercial in confidence. However, what I can advise is that the agreement requires We're Optimo to meet jobs targets here in Queensland. So this is all about securing new high-value manufacturing jobs here in Queensland, as well as delivering better healthcare to Queenslanders.
The money you're putting in, does that mean we'll see vehicle devices, I guess, in the state?
Yeah, we hope so. Within a few years, I know our health service is very excited about the applications in hospital. I know our resources sector, we have a very big resources sector and one of the safest in the world, and I know they're very interested in its application to keep their workforces healthy and safe. And so there really is an opportunity here for Queenslanders to be coming up with the first applications of this new technology and to benefit from it.
Other topics?
COVID.
Tourism industry doesn't want the government to be trigger happy on the border. Can they have confidence that they won't be?
I wouldn't characterise our approach at all that way at any stage. We have consistently taken the health advice, and right now we're reaping the benefits of that. There are a few places in the world that are as open as Queensland is right now, and that's thanks to the approach we've taken. So while I understand that that's had a disproportionate effect on some industries, our entire economy is benefiting right now from that approach.
The New South Wales government has asked for greater control for its rollout of the vaccine. Do you think that's something that Queensland would like to see have control of as well?
Look, historically, vaccines have been the responsibility of the Commonwealth, and while we have offered and taken on a share of the rollout of this vaccine because we know how important it is to our state and to the country, it's important that the Commonwealth continues to meet their targets, continues to do their job, which is the majority of the rollout of the vaccine.
Do you think it could make it faster though here if we do take control?
What I know is that getting that vaccine out as quickly as we possibly can is our pathway out of this thing, and so everything that we can do to get people vaccinated as quickly and as safely as possible is incredibly important. But the Commonwealth is ultimately responsible for the vaccine rollout. We're supporting them where we can. We think that it's incredibly important that people's trusted primary healthcare providers, particularly their GPs and their pharmacists, play a crucial role, and really the best way for that to happen is through the Commonwealth. If there are issues to be sorted out between the Commonwealth and Medicare service providers, well, that's really important. They should do that.
Are you concerned about the figures on the front of the Oz today? It doesn't look like they're going to hit their targets really in this first little phase.
I am concerned. It's a big logistical task, though, and sourcing supply is going to be one of the main challenges. And so, look, obviously, we want to see it roll out. We want people to be very, very confident in the rollout, and we want to see Australians vaccinated as quickly as we possibly can. There are a lot of variables, and the number of people that will need to be vaccinated every week during the peak of that vaccination program it's very, very high.
Do you think it's going to be finished in October? Looking at those figures, it doesn't look like it.
Well, the Prime Minister committed that it will be finished in October, and so I think it's up to him to make sure that it is.
Given the popularity.
What's the vaccination total in Queensland today? How many have we done?
The last I checked, I think it was 14,000.
And how many
16,000 now.
16,000. How many have we got sitting in the storage?
Look, I don't know how many we have on hand now. Our program is very much based on being reliant on those arrivals. I know that Zoe, our first nurse, will get her second shot next week on the Gold Coast, and that's the start of that second shot of the vaccination program.
Given the popularity of the $200 giveaway, is the government going to redo it, and have you thought about where?
Well, it has been very successful, and we will, I'm sure, monitor that success before making any future decisions.
What do you
think about Queensland getting a bit of grief from, say, other states who point out that we've got 4 locations for the federal cheap flights initiative, but then seem critical about border stance?
Well, I think this program could be better tailored to Queensland. One of my favourite places to visit in Queensland is Townsville. It's a beautiful place, and there's lots of beautiful places to visit near it. There are tourism operators there are struggling, and I don't know why they were left off the list, why the Morrison government hates Townsville. I don't know why they hate Hervey Bay. Like, why wouldn't you include Hervey Bay in this program? And similarly, Queensland is the tourism heart of the country. Why should people who live in Brisbane be excluded from visiting places in their own state, supporting places in their own state? So I think, we've seen overnight they've already started adding places. I understand Darwin and Adelaide were added overnight. We'd really like to see Townsville and Hervey Bay added. We'd also like people in the southeast to be allowed to travel to the north. Cairns is, after all, further away than Melbourne. Lots of people in Brisbane haven't visited Cairns. Cairns is one of the places that is in most need of support.
Just back to the vaccine, we saw several elderly patients have an overdose of the vaccine. As a former health minister, how concerning was that for you, and how important is it to make sure we don't see that again?
That was concerning, and it was concerning that it happened so early in the rollout in aged care. It was personally concerning to me. It occurred in the aged care facility attached to the retirement village where my grandma lives. The onus is on the Commonwealth to ensure people can have confidence in this program. They have taken action against that provider. I understand Queensland Health has also. They registered them as a healthcare provider in the state. I think it's important that people see that that has occurred. We need to ensure that everyone administering this vaccine is properly trained and that there are adequate processes in place to ensure they've done that training.
And the federal government has blamed state and territory governments for the shortage of seasonal workers, saying it's because they can't agree on sufficient quarantine arrangements for the 25,000 people that have been made available. What's your response to that?
Oh, look, I'm not across all of the details of those kinds of discussions these days, but what I know from the time that I was is that our Chief Health Officer has worked very, very hard with our industries to ensure that they can continue to operate throughout the pandemic, and that's why we've seen such great results. Our agriculture, resources, construction, they were all able to continue operating when in most places in the world they were not, and I'm sure they are working very hard. Queensland Health will be working very hard to make sure that our farmers have the workers they need.
Do you think discussions with the feds on the regional quarantine hub are a bit of a stalemate?
Well, they are, because we can't get a clear answer out of the Prime Minister. You know, we've done a lot of work, the Wagners have done a lot of work. This National Quarantine Centre could make a huge difference. It could keep our communities safe, it could see more people returning, and ultimately that's our motivation here. At the very least, all we need from the Prime Minister is an agreement to allow flights to land there, and we can't even get that. Once we get approval for flights to land there, well, the Wagners will get on and build it. People will be able to transfer directly from a plane into that facility. The workforce will be able to stay on site where that's appropriate and suits their working arrangements. There will be safe and secure ways to transfer freight in and out of the facility. We've said for a while now that hotel quarantine has been really effective, but with these new strains, it wasn't designed, our hotels weren't designed to be quarantine centres. When we design a room for someone who might be infectious in a hospital, we make sure it's negative pressure, that the air moves inwards, not outwards, whereas hotel rooms are the opposite, and that's what led to those snap lockdowns in a number of our capital cities. That's what we want to avoid. That's what this National Quarantine Centre would allow, and frankly, you know, I think this is more about Scott Morrison wanting to continue to prosecute his attacks on our government than it is about a rational assessment of this centre.
Clive Berghofer on that topic says, you know, we've had hospitals on code yellow cans due to the influx of PNG. He says that could happen in Toowoomba if they got the quarantine camp there.
Now, the quarantine centre will be very, very safe, and Queensland Health will ensure that there are health services both at the centre and at hospital should people need to be transferred for COVID or for any other reason. You've got to remember we'll put in place here health plans for people who get sick with COVID, as well as anything else that might happen. There's going to be 1,000 people on site at any given time.
Have you guys given a costed plan to the feds? And isn't it just going to bounce along and then it'll all be over by the time someone makes a decision?
Look, I understand a lot of detail has been provided to the feds, including those anticipated costs. I understand the Wagners are confident that once they get the go-ahead, they could be functioning really up and running really quickly. And you know, even if Scott Morrison manages to meet that October timeframe, which, as we've seen, there's reason to be concerned, there will still be people returning from around the world to Australia right throughout that time and even beyond. And so this facility will be useful, will allow more Australians to return home more safely, and will avoid the risk of those kinds of snap lockdowns.
Overnight, I think there was an Olympics meeting. Now that 3 levels of government have publicly declared their support for the Brisbane Games, when will we actually see a funding agreement reached?
I'm not across the details of that meeting, Patrick, but things are moving really positively. You'll have seen that. I'm really excited. I think it's time for the Southeast to host the Olympics. Sydney's had one, Melbourne's had one. I think we're ready. I think it's great that we have alignment between the three levels of government. As I understand it, most of what would be required to deliver the Olympics is what we would already be doing anyway as our city and our region continues to grow. I've had some involvement in those discussions through, as the Minister responsible for the South East Queensland City deal, but the finalisation of those things I think is still a way off.
But it would have to be, I know you're talking about making a decision before Tokyo, so you'd probably want to have that locked in so it all looks united and done deal and everything. Would it be before Tokyo?
Yeah, look, obviously to the extent that we can, we'd want to have as many things agreed, but the games themselves will be 11 years away. The decision isn't contingent on big investments. In fact, it's quite the opposite. This is the new process that the IIC is using, where they're endeavouring to make it, endeavouring as far as they can to limit the cost of having the games.
And with the restrictions easing, the Broncos are back tonight, I think. Am I right? Is it life returning to normal?
Well, it is life returning to normal. You know, I remember really clearly that Broncos game in Townsville, which was pretty much just before we did the lockdown. There was a lot of focus on whether that game would go ahead. That must mean that was about 12 months ago. About 12 months ago now. We went into the lockdown, the Broncos were 2 from 2, and tonight they face Para again. Para's given us a few embarrassments recently, so I think this is a great chance for the new look Broncos to beat them and beat them well, and I'll be there cheering them on.
All right. If you're done, sorry, these guys had a couple of words,
Yeah,
but you went
please.
straight to the press line, so I'll calm down. If you can- Yes.
All right, thank you.
If you so you ready to go?
All right,
Thank you.
thank you. Look, my name is Professor Keith Nugent. I am the Deputy Vice Chancellor of Research and Innovation at the Australian National University, as well as being a board member of Wear Optimo. So I'm delighted to be here on behalf of ANU, Australia's National University, to celebrate this important announcement about the investment that we're pursuing here. Just a few comments about ANU's background and how we fit into this. ANU, Australian National University, was established 75 years ago with a mission to help Australia rebuild after the Second World War. And a cursory look at ANU's achievements will show that we were in fact very successful in helping build Australia to the place it was today. And so it feels also today, after the global pandemic, that ANU is again needed to do what it can to bring its enormous research expertise to Australia so it can help rebuild it again after the events of the past year or so. So it's very clear, and there's been a lot of discussion around this, of course, in the media and through government, that universities, while remaining true to our key missions in teaching and research, and in ANU's case our motto is to be the first to know the nature of things, we must continue to do that. But we must also ensure that the key ideas that come out of university research must be retained in Australia and used to help develop Australian industry for the benefit of Australians. So today is a wonderful example of this mission in action. As we've heard, Wear Optimo's revolutionary technology will deliver better outcomes for patients, for Australians. It will help us better tackle serious illnesses and medical conditions, and it will create jobs and economic benefits for Queensland and for Australia. So this combination of deep scientific and engineering insight to build important new technologies and businesses is precisely what ANU needs to do. So as the national university, and it's an important role, we are Australia's only national university, ANU is committed to working closely with industry, government and community right across the country. We are the national university, so while we are based in Canberra, we're delighted to have this really significant and important base in Queensland. So ANU is indeed proud to have supported and invested in Mark and his team, and Wear Optimo in general, over the last 3 years to give them the operational platform to succeed, demonstrate their technology, and attract significant next stage investment. The partnership and funding announced today is the next vital step in Wear Optimo's work. We see this, we look forward to seeing this revolutionary technology go into production and be exported globally. Technology that, as I say, will not only improve lives, it will help ensure Australia is at the forefront of a global healthcare revolution. So today, I want to thank the Queensland Government for backing this vision and for backing Wear Optimo's vital work. It is critically important, along with the other partners, and Ian will talk soon. So ANU welcomes the government investment in Wear Optimo through the Essential Supply Chain Program. This funding is a welcome boost to our key mission to improve Australia's lives. That is what we want the Australian National University to do. That is our goal. And this is an investment in one of the very best examples of Australian innovation and research and development. And most importantly, I think, it's an investment in the health of millions of Queenslanders, Australians and people ultimately all over the world. So we look forward to working with Mark and continue to see this grow and develop. So thank you.
Thank you.
Good morning. I'm Ian Griffiths. I'm the CEO of the Australian National Fabrication Facility. I'd like to congratulate Mark and his team taking an idea from somebody's head and turning it to the point where you're about to enter production is a very long and difficult journey. My organisation would know most of the steps in that journey as we've been partners and we've facilitated the access of equipment all over the nation through various nodes of our operation. So with that said, we hope that we can play a part in the next phase of the Wear Optimo journey and work with Mark and team to move into production.
Thank you.
Second question, do you know like the economic modelling for like how much this is meant to save, say, the Queensland healthcare system, or what's the...
Sure. So Wear Optimo has a 10-year roadmap that we're executing on, and the idea is to push out multiple applications of micro-wearables in many applications. We've talked about a few of those today. The one on my wrist, so the hydration sensor, and that's in the energy, mining resources, other sectors including potentially the military. We have a partnership with Asthma Medical on that for rolling that out. But also in addition to that, the one the Minister was talking about before, which is early detection of heart attacks. All of that will have, when rolled out, will have a massive impact in a positive way for healthcare systems. To give you some context, the size of the market for healthcare, it's not a good way to talk about it because it's about people, but it's $10 trillion per year. It's the biggest market on the planet. It's the biggest cost on the planet, and that was a pre-COVID figure. So improving things just by a little bit, a few percent, can make a massive difference in that space. And if we take a look at Queensland, we have a lot of rural settings, we have Indigenous settings, a lot of settings where instead of people needing to get on a plane and go to hospitals, or dare I say, not even make it because they haven't had the chance for intervention to take place, our type of micro-wearable sensor, when rolled out, can make a massive impact in that space.
Can you say something about how useful it could be monitoring COVID patients?
Yeah. Oh, yes. Thank you for the prompt. So the vision for Optimo, I'll state it very clearly. The first is to do all the things I've just talked about, but the second is we're a national asset, and that means if there's something that happens in the country that we think we can help with, we do it. And one embodiment of that is the way our company has pivoted really quickly to take forward a sensor to help in the context of COVID-19. So it's the early detection of a key biomarker that can give you a warning that you're going to get really sick really quickly when you have COVID-19. So that biomarker is called IL-6. And that really sick that I've talked about is a cytokine storm. And so that's another key embodiment of what our platform has the capability of doing. We can't do everything all the time, so we're focusing on particular areas, but with this capital and support that we've now received, it gives us a new platform to take things to the next level.
So just to clarify the wearables, this one that you've completed is purely for hydration? Do you program them different ones for each?
It's a platform. So it's a bit like, so a good way of talking about it is the way vaccines are platforms. So a vaccine technology that's been around, you reconfigure it, and then you apply it to the next thing. Now, it's a lot more complicated than that, but we've witnessed the fastest rollout of vaccines in human history with COVID-19. Now, similarly, what we have with the micro-wearables, it's a platform, and it can be applied in many different areas. And there's a lot of shared components of that platform. The one thing that's different is the way we sense. So it's like Lego, if you like, on a micro-wearable structures that just reach a hair's width into the skin. It's like Lego that clicks for a particular biomarker. So whether it's a COVID-19 click, or alternatively in the case of a heart attack, so the biomarker is called troponin in that case, but if it's a troponin click. And indeed, over time, what we foresee is the concept of multiplexed. So what I mean by that is detecting multiple different biomarkers at the same time.
Thank you.
Excellent.
Okay.
Well, thank you. Thank you.
Thanks. Of course, yeah. So I was just wondering if we can get a photo with the partners and then get a cup of tea. So thanks everyone. There's coffee and food. Please mingle and enjoy.